doctors and the idea of cultural compatibility. Apparently, years ago, a friend was asking about what do you look for in a doctor, and I told him I don't remember saying this, but someone who's similar to you. He told me wonderful advice, found a great doctor, thank you for this advice. And I didn't recall at all saying that. But it's true, right? Somebody who's similar to you, culturally. And so I feel this is one of those things I've been sort of struggling with, or shall we say, developing the thought. We found a PCP for my wife, primary care doctor, and we went to her recently, and I hated her, and my wife did as well. So, caveat, I presume that there's people who like her, she's a doctor, and there's patients. Though I guess at Kaiser you don't have much of a choice. Maybe that's why her panel is open. But anyway, let's just give her the benefit of the doubt that there's people who like her style. Let's call it style. But her style is to just say sort of whatever you say, oh, no, that's okay. Oh, don't worry about that. Very dismissive is the way I'd say it. And I also feel that she doesn't listen, right? Rather, that's my wife's term. I said she doesn't ask appropriate questions. So, for example, we're trying to figure out something about prior colonoscopy. And she was wondering if, my wife had one. And she's like, did you get sedation? It's like, well, first of all, patients don't know what sedation means, right? Even in the medical field, most people don't know what sedation means, right? What's the difference between conscious sedation, right? General anesthesia. How do you say all these things, right? So when you tell a patient you're going to have anesthesia, well, that's very generic, right? Anesthesia could be there just to give you some medications. An epidural is done by anesthesia usually. Anesthesia also could be put you under in the operating room. Also, something in the operating room they may not put you under, right? There's this whole wakeful, deep brain stimulation implants are traditionally, you're awake. So all these things are sort of different. They could do different methods, shall we say. When you go to the MRI, do they actually put you out or just give you some stuff to make you sleepy? As a doctor myself, right, we order some sedation, but we don't to the level of conscious sedation. We just give some stuff to sort of calm some anxiety, which is sedating, right? They're sedatives. Benzodiazepines like Ativan. So the thing is, first of all, you're trying to figure something out from the patient, right? Asking questions, I would say, is very important because you got to try to figure out what you want to know. And if you don't ask the right questions or know how they're responding, then it's sort of a moot point. You can't listen to them. My wife's conclusion is she just doesn't listen, right? You say stuff, she doesn't hear you. I would say, well, that's very interesting because I feel like when you say stuff and people respond with questions, right? I guess maybe in this case, she's not listening to you. In some cases, I would say, I'm trying to figure out more about what exactly you're saying. That's why I'm asking questions. That's why I don't continue to just let you talk forever. But I think the gist of it is that her style doesn't match with ours, right? I want to find a Vietnamese doctor. She's technically Vietnamese. She started out by saying, do you speak Vietnamese? Because, I prefer English, right? Which is your preferred language? That just sort of shuts the door if it ever was open, right? The whole reason I try to find a Vietnamese doctor is so she can speak to my wife in Vietnamese if she so chooses. Because there are a lot of medical terms and stuff. It's just easier for people to communicate in their native tongue, right? I mean, I found this true in Sweden. Swedes are known to be very well educated. They speak other languages like English. But in the medical field, the doctor still spoke to them in Swedish. They're just more comfortable, more natural, which is what you want to have in a medical setting, right? And I think the thing is, what is the right culture, right? I like a doctor who's very relaxed, who takes time to listen to you, doesn't seem like to hurry, listens, hears you out. They may ask questions. They don't use big words because I hate big words, right? How do people understand? And we all know, at least doctors should know, if a patient doesn't say yes or no, doesn't mean they understand. Most patients are afraid to challenge you or to ask questions. They don't want to appear stupid. So what do you do then, right? And so my thought is that the way you want to do it is you want to have a patient interaction, right? Where they feel comfortable, they can express themselves, you resolve their concerns, but you have to hear their concerns first before you brush it off, right? Otherwise, you didn't hear them out. They don't feel you address their issues. Maybe some people like that sort of more dogmatic, brusque approach, saying, okay, right? Yeah. And I feel like the other thing is, in terms of culture, is it easier to have somebody who understands your culture, or how important it is? So the person who said I did a great job telling him how to find a doctor, he said, yeah, my white blood count is sort of low, but he said, this is normal for Asians. We're Asian. This is fine. It's just they don't have charts for us Asians, which is true, right? Most of these charts are based on the West, which is white people. The second thing is, your doctor understanding culture is important because things may be done differently in Vietnam. If they're from Vietnam and you're from Vietnam, you may understand how things are done in the home country, right? It's important because things are done differently in the US compared to Europe as well, right? So, for example, in Europe, right, it could have been, 10 years ago, they're like, oh, you got your cardiac cath, right? Blah, blah, blah. And they presume it's done through your wrist. The US didn't catch up till recently doing it through the wrist. They usually do it through a femoral, which has more risk of complications. This has different risks, but less risky in general. But I think that's the whole thing. Understanding where somebody's coming from. Having at least an understanding of their background. That is so important for the patient-doctor relationship. And the thing is, many times we don't. For example, Russian patients, I just really don't understand. I mean, there's stuff I see on TV, all this stuff, but how accurate is that? It's like saying everybody in the US is like a Hollywood star, like, Clueless or whatever, right? And like, that's just not true. And I'm sure that's not true of Russians. And I think that's sort of one thing why, even though you're like, well, shouldn't you go see everybody? Yes. But culturally, I think it's very important. And so compared to other doctors who are not from the US who came here later in life, I think it's much easier for me to relate to a lot of Americans, older Americans, white Americans, right? Black Americans, because the culture is much more similar to me, right? I was born here, raised here, so a lot of stuff we share commonalities. I think that's why when you look for a doctor, right? Or when you ask a patient, what is their background? How do they approach stuff? It's good to know about these things. Helps you have better rapport, relate, and get your work done, which is caring for patients.